Do you want to know what language to use when you speak to your patients? Hi, I'm Dr. Germán Gomez and I'm in Valencia, Spain. Today, we want to talk about what language to use for your patients. You will learn how to replace negative words by positive words, how to avoid technicisms, and what are the mistakes in communication. Words make a difference. You have to start transforming your vocabulary. Instead of using certain words that produce a barrier, that trigger something negative in the patient's mind, you need to start using words that are either indifferent or positive. Here are some examples. Transform but to and. Transform however to and. Transform try to will. So it's, yeah, you're right, but I think blah blah blah. No. Yeah, you're right, and I think blah blah blah. Different. Yeah, you're right, however, I think blah blah blah. No. Yes, you're right, and I think blah blah blah. Or yes, I will try to, no, I will do, I will make it happen. Okay? Should, transform it into must. You should do this and this. No, you must do this and this in order to make something happen. I was wondering if, transform it into I recommend that. I was wondering if you could use dental floss. No, I recommend that you use dental floss. I failed. I am learning. You might want to consider. No, I highly recommend. I may be able. No, I will. Do you have any questions? No. What questions do you have? In another lecture, I will talk about this topic better, so you understand why do you have any questions is not a good idea. And it's much better idea to ask what questions do you have, or what question do you have. Now, for afraid patients, you need to use certain words. Here's a list of words that you should use if you feel that your patient is afraid. Learn them by heart and apply them. I will give you words and sentences for different kind of patients. And these words and sentences I did not come up with. These are words and sentences that are made by psychologists, and they work. They work really well. For afraid patients, use how do you feel? We take our time, so you calm down everything, you pace down everything. I promise you. Can I help you? What do you fear? Tell me honestly what you fear. We take good care of you. They must be sure. They must be certain. Remember, they buy certainty in an uncertain world. For arrogant patients, patients who know it all, are very arrogant, okay, they need to hear several things, and then you are their best friends, okay? Although you tell them you are wrong, don't say that directly, okay? Use other words to do that, okay? So, you start with, or you use, we appreciate your opinion a lot. This helps them to feel important. Arrogant patients want to feel important. That's their problem. That's why they are arrogant, okay? Now, we appreciate your opinion a lot. can we do something special for you? Special. They need to feel special. You certainly know about the subject. Praise him. Praise the arrogant patient. I have special information. And then show him why he's wrong, without saying it directly to him that he is wrong. Okay? So you praise him and then you give him some extra information, special information, and with that, you tell him what's your opinion on the subject. Okay? We find out where our error was. Okay? So you don't say we made an error. You say, okay, the arrogant patient is complaining. So you say, okay, we find out where our error was or where our mistake was. Or another sentence, this is certainly very important. Remember, they want to feel important. Your opinion or your critics is very important for us. You are very important for us. We try the best for you. They want to feel special. They want to feel great. They want to feel good over everybody, you know. Or what do you think about this? Let him give you his opinion. They want to speak. They want to decide. They want to be the middle point of everything, you know. I share your opinion, okay? Or your treatment is very important. So because he's a very important person, remember, he's an arrogant patient. He's a very important patient. His treatment is very important. Okay? Arrogant patients. Depressed patients. Depressed patients need to hear or listen other words. For example, this has been proven a lot. They look for certainty. This will work well for sure. Or see it this way. Take it to a positive side, everything. Or we help you in this. Or we understand that you are concerned. Or take your time. Or we could solve it, for example, like this. Or we have made very good experiences with this. They look for certainty. You are lucky today. Raise his mood. Today is going, it is going especially well. Or today it looks especially good. Okay? So this, everything you say here helps a depressed patient. Again, learn these sentences by heart. Know with which patient you can use them, and then use them in the beginning of the sentence you want to say. Okay? This helps. For aggressive patients, arrogant patients, different than aggressive patients. Aggressive patients, you are obviously very angry. This has made you for sure very angry. Show empathy. Show that you, although you disagree with the point that he is angry or the reason why he's angry, you need to show that you understand that that you know that he's angry. You confirm he's angry, okay, and then that you want to look for a solution. Okay, I can imagine how angry you are. Can we speak calmly about it? I will check exactly where the error has been. Can you describe exactly what makes you so angry? Probably I would be angry too in this situation. Or good that you have told us about it. Or we take your disappointment very seriously. Please tell me what makes you so angry. Then they can explain. Okay? All these things is important for communication and for selling. So this chapter is in both courses, communication course and in selling course. Use of words, negative words, change them. Don't use sell. Use to get, to own, to become. Don't use sign. Use confirm, accept. Instead of sign here, accept here, please. Or please confirm here. instead of it costs or you pay, you say you invest. This is a wise decision. It's a long-term thing. It's good. Negative expressions like, this is not true, you are wrong, that is not correct, I know that better, I have to correct you here, I cannot agree with you, don't use them. Change them. Okay? Don't ever use one of these sentences. Positive expressions are like, seeing it your way, you are surely right. And then you can go on with according to my information, and then you put your standpoint. Okay? So, interesting opinion, according to my information or according to my knowledge. Okay? Seeing it this way, it is correct. And according to my knowledge, and then you say the opposite. Okay? I understand. And according to my knowledge, but I haven't seen it this way. Okay? My opinion on that is, I think about it like this. According to my information, according to my knowledge, the newest state of knowledge about this is, and then you explain how you would proceed. According to my many years of experience, I would do this and this and this, or I recommend to do this and this and this. Okay? These are positive expressions. To act or to talk against a patient that has told you wrong things. Okay? Errors in communication. Don't use these sentences. You have to do this. You have to do it this way. Don't use it. Use instead of that, you could maybe do it this way, or we try together to do it this way. Okay? Don't say, you should take care to. Say, here it would be good to be a bit more careful. Okay? Don't say, I have to do this and this on you. Say, a solution would be to do this and this on you. Okay? Again, don't use that's wrong. Instead of that, say, if you would do it like this, it would be better, blah, 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 blah. This does not look good. For example, oh, this tooth does not look good. Don't put the patient in a state of being afraid or uncomfortable. Instead of that, use a mirror or use something to show him and say, did you notice this here? Completely different thing. You don't brush your teeth at all? Okay, don't say that. Say, here you have some areas that could be improved. Okay. Effective words for patient interaction. Instead of pain, say discomfort. So this treatment will be painful. Don't say that. This treatment can include a little bit of discomfort. So, instead of shot, say anesthetic. Well, at the beginning I will give you some anesthetics. That doesn't, the patient doesn't see the needle. If you say shot, he sees the needle. He sees in his mind a needle. Instead of pull, try this, remove. Say remove instead of pulling. Instead of drill, say prepare the tooth. Well, I will prepare the tooth, and then instead of, well, I will drill all your teeth. Oh, that's okay. Prepare the tooth. Instead of filling, say restoration. Instead of false teeth, say denture. Patients understand that much better. And it doesn't have the feeling, they don't have the feeling of this fakeness, okay? False teeth, that's super fake. And it doesn't look good. You hear false teeth and it already doesn't look good. Instead of operatory, you say treatment area. Instead of waiting room, you say reception area. Because remember, nobody has to wait. Okay, what terminology to consider? Instead of x-rays, say radiographs. Instead of prep and seat, say a complete two-step procedure. Instead of composite or inlay, say tooth colored restoration. Instead of prophy and cleaning or cleaning, you say professional prophylaxis. Instead of talk about financial issues, you say talk to the treatment coordinator. Instead of sign here, say approve or confirm. Instead of policy, that's our policy, you say that is our guidelines. Policy is too strict. Guidelines is something okay. Instead of work, say treatment. There's a lot of work to do. There's a lot of treatment. We will do some treatment on you. Instead of pay, say take care of or invest. Instead of recall, say continuing care. Instead of buy, say own, invest, take it home with you, take advantage of this, move forward, okay? Instead of, well, do you want to buy it? You say, do you want to move forward with it, with the treatment? Okay? Instead of, do you want to buy the treatment? Okay? Or do you want to invest in your smile? Something like that. Instead of contract, they think they sign their life away if they hear the word contract. So you say agreement. We can agree on something. Or instead of contract, you say paperwork. Let's get the paperwork out of the way. Huh? Agreement or paperwork. Instead of we are better than the competition, never put down the competitor. Even if it is a fact, they should come to their own conclusion that it is true. Okay? Don't talk bad about the competitors. Never. Never ever. Okay? Although you see they made a really, really, really bad work in the mouth. Please. That's what I learned in dental school. Please consider. They are our colleagues. Okay? And being our colleagues, they have learned the same way we have learned, the same profession. So they know what is correct. Okay? There is a reason why this work is not correct. You don't know how it was before. You don't know under what conditions your colleague had to make that work. Okay? And you don't know how it looked immediately after he made that work. So we cannot judge the work of a colleague in the mouth. We can judge how it is now and what is the situation of the mouth now. Okay? Including the work of the competitor, yes. But how it is now. That does not mean it was badly done. This is the state. It's not correct right now. Okay? Then let's fix that. But do not talk badly about it. Although you might be 100% sure it was because of bad technique, because of bad material. I don't know. Okay? Don't say that. It's also Snoopy talk, okay? You may need to have those thirds removed. Thirds, who knows, what patient knows what thirds are? Instead, say, your wisdom teeth need to be removed. Or, Johnny looks like he's headed for ortho treatment. Instead of that, say, Johnny looks like he may benefit from braces. Ortho treatment. Nobody knows what that is. There's a very heavy buildup of calculus on your teeth. Who knows what calculus is? They think it's calculating something. Okay? There is a very heavy buildup of tartar on your teeth or of stone on your teeth. Tooth number 30 will need endo, or tooth number 1.3 will need endo, or tooth number 1.6 will need endo. Okay? Instead of that, say the molar that is second from the back on the lower right will need root canal treatment. Instead of quadrants, say in dentistry we divide your mouth into 4 corners. Instead of scales, deep scaling, periodontal scaling, say gum therapy that includes numbing the gums and cleaning out bacteria that is built up on the roots of the teeth. Instead of anesthetic, anesthetize, say numbing medication. Instead of topical anesthetic, say numbing gel or numbing rinse. Instead of bonded filling and composite filling, say white filling. Instead of explaining a product by its name instead of what it does, I'm going to apply Gluma to this sensitive area. Why? Say, I'm going to apply a liquid dedentizer to this area. Some may feel this is an oversimplification of what we do, but I feel it gives patients a place to start their understanding process. We can always add details as the patient understanding increases. Now, persuasion words. Persuasion words are used. These words work in the subconscious mind of the patient. You say introducing instead of offer. You say, well, let me introduce you to this new treatment we have here. Okay? This is in the subconscious mind, it triggers a positive emotion. Investment instead of paying. They invest in themselves. Yes. Use this word every now and then. Yes, it's a good persuasion word. Yes, yes, yes. If they hear yes a lot, that's positive, positive, positive the whole time. This works step by step. Sounds easier, not complicated. Well, okay, let's make it step by step, and so it's not complicated for them. Now, creates sense of urgency. If you say, well, we will do it now. If you use now several times in the presentation, then it creates in the patient a sense of urgency without being pushy. Here's what you get, or here's how it works. This is what's going to happen. You. Use it as much as possible. Say a lot of times, either the name of the patient or you. Patient's name, use it as much as possible. I hope this video was helpful for you. Thank you very much for your attention. Please subscribe to this channel, click on the bell, turn on notifications, like this video, share this video, and comment below. Bye.